Hello, my name's Adam Richmond. I'm an osteopath at Lacemire Clinic in Nottingham. One of my big bugbears has come up again this week, comes up most weeks actually, and that is the idea that a sacroiliac joint can get clicked out of place or can get stuck out of place and needs clicking back into place. A lot of patients come in and tell me this, and quite often the reason they tell me this is because they've seen a different practitioner previously who's told them that the reason for their pain was that their joint was out of place. So why is this a problem? Well, it's a problem because it demonstrates a fundamental misunderstanding in what's going on with the joint, and the problem is made worse by the fact that when a joint is clicked, quite often it feels better afterwards, so it gives the illusion that it's been clicked back into place. But this, as I say, is a misunderstanding of what's going on, and this can only lead, in my opinion, to not being able to get to the bottom of the situation, in that the patient's probably going to have to come back again under the belief that the joint needs clicking back into place again. So how do I know that a sacroiliac joint can't be clicked out of place? Well, firstly, I've done human dissections. If you've ever, most people watching the video won't have done, and to explain it to somebody who hasn't seen or done a human dissection is very difficult, but the ligaments and supporting structures around that sacroiliac joint, they're humongous. They're so strong. The idea that they could be sort of clicked out of place by stepping up a curb or a rugby tackle or something like that is just crazy. The sort of forces needed to break those or move those ligaments beyond their anatomical range of motion, it's the sort of forces that you're talking about in very severe car crashes, and that sort of thing. The idea that we can do it in normal everyday life, it just isn't true. But secondly, there's a mountain of evidence that this isn't the case. Most interestingly, in my opinion, is this article in Spine, which was published in 1998, where they had 10 patients with symptoms of sacroiliac dysfunction. Okay, so they had 10 symptomatic patients, and they had practitioners who were experienced and believed in the idea of clicking. Well, whether they believed in the idea, they knew the techniques used to click joints back into place. The patients were assessed thoroughly. They were then treated. Every single instance, the patients responded well. Their symptoms improved. Okay, but the really interesting thing is they did a really clever, it's called a stereophotogrammetric analysis, a Roentgen stereophotogrammetric analysis. This is a really accurate form of X-ray where they use two machines and they have markers on the bones that they can assess the exact position to within 1/10 of a millimetre. They scanned people before they were treated and after they were treated. So bearing in mind they were symptomatic before, they were not symptomatic afterwards, and it showed that in standing, the sacroiliac joint, so the position of the ilium in relation to the sacrum, this is the sacroiliac joint here, had not shifted, had not changed. The relative position was still the same. So the idea that the practitioner has clicked the ilia forward or moved the sacrum back or something like that just isn't the case. Something has happened, the symptoms have improved, but it's not the joint moving. So the obvious conclusion to take from that is that whatever has happened, whatever has changed, has happened in the soft tissues, has happened in the muscles, the connective tissues, the capsules, the ligaments, whatever it is surrounding the sacroiliac joint, that something has probably changed and the symptoms are reduced, but the joint hasn't moved. So understanding that leads us to a much more intelligent line of thought as to, if this is something or a common problem that a patient's presenting with, how can we make them feel better? We know that we're not clicking them back into place, so it opens the mind up to other thoughts of the types of intervention with exercise and stuff like that, which can help the patient feel better. And quite often, in my experience, we can get good results in resolving these type of recurring problems. So the real problem, my bugbear, is right there, that a patient who feels they need clicking back into place is fully reliant on their practitioner to click them back into place, whereas that idea is false. we've shown that it's the soft tissues, so the patient can therefore start taking control through exercises and not needing the practitioner. I'll leave you to draw your own conclusions as to why this might happen. I think in a lot of instances it is probably just not really being up to date with the research, but this research was published in 1998. Really we should be doing better than telling people we're clicking them back into place. So any questions, please don't hesitate to contact me. My name's Adam Richmond. I'm an osteopath at the Lacemart Clinic in Nottingham, where we don't just work behind your back. Thanks a lot.